need an ID for your registration to the chief?
For specialized groups, say for instance teenage mothers, teenage mothers will not have an ID. At times you may have a refugee who needs to have access to care, and they may not have the appropriate identification. Equally, the mental illnesses who are just maybe picked from the streets, or street children, okay, or street adults, yeah. So those are special or unique cases, and we are saying we are leaving no one behind. Every Kenyan must be able to access quality care services, and so that is why we are saying that was a challenge before, because we were relying or dependent on the identification card. Even as the immigration ministry addresses the issues of identification cards, we are saying Kenyans should be able to access services no matter who you are. And so that is why we are having those leeways, we're having those discussions, and we're having unique identifiers. For the NHIF, again, the motivation was again a challenge. They were not confident, they were not well informed if they will be onboarded or not. And so we have engaged them. We see that there are over 1,700 NHIF staff, and we have 70 NHIF branches, which we are now calling the Social Health Authority branches. So a ratio of 1 to 70 healthcare providers. And indeed, these are people, human resource capacity that we can use in terms of strengthening the healthcare providers, strengthening and informing the community, informing, being used for sales and marketing of the Social Health Authority, ensuring that employers onboard their employees, among others. So again, we are encouraging the NHIF staff. We are having a seamless transition. We are telling them that none of them will lose their jobs, and they will keep the very same salary that they will have. So we have had critical